Good to have you with us. You're watching The Urban Debate. I'm Avni Raja, and our focus today is on the situation across the country as far as the second COVID wave is concerned. Now we're practically bringing back several of the curves that we had seen last year, and at the same time, with the spike in cases, there are multiple cases or multiple instances across states of brazen violations of the COVID norms. So whether we talk about West Bengal, which of course is a poll-bound state, multiple rallies, and of course now with the Holi celebration upon us, people are completely flouting the guidelines and the rules and not giving any weightage to social distancing or masking up and flouting those guidelines. Meanwhile, in Karnataka is the other example that we're seeing in Bengaluru, where Holi parties are being held and people are not maintaining any kind of distancing or any kind of masks as well. And in fact, it's not just these two states. Even in Maharashtra and Mumbai, in fact, the Chief Minister has now said, in fact, he's asked officials to prepare stricter norms, literally similar to the kind we had seen when the lockdown was in place last year. And he has said that if people do not adhere to these norms, adhere to the guidelines currently, and cases continue to rise, he will be forced to impose lockdown-like circumstances across the state at this point. Remember, Mumbai has seen 6,000 plus cases. Maharashtra also seeing the highest number of cases across any state in the country at this point in time. So the question really is, what's happening? Are we in a position to be able to deal with this without it spiraling out of control? Are the authorities lax in imposing these rules, or are people just not bothered anymore, and COVID fatigue, as it's being called, is set in with people just don't want to follow guidelines any longer after so long? So to talk about all of this, joining me at this point in time is Dr. Om Shrivastav, Director, Infectious Diseases, Jaslok Hospital, Dr. Anoop Amarnath, Chairman, Geriatric Medicine, Manipal Hospitals, Member, Critical Care Support as well, Unit of the Government of Karnataka, Dr. Sunila Garg, Professor of Excellence Community Medicine, Maulana Azad Medical College, New Delhi. Thank you, all of you, for joining us on this edition of the Urban Debate. And this, I believe, is an extremely important issue. This is going to be that, turning point on whether or not this entire situation spirals out of control. Dr. Shrivastav, if I can start with you, what is your own assessment of this situation? Because day in and day out, at least on Mirror now, we're reporting how the violations are completely brazen. People are just not bothered.
That is probably a fair assessment to a very large extent. I think that, as you were mentioning in your opening comments as well, there is a fatigue. I think that while there may be people who might want to comply, the year that has gone by has left a state of just couldn't care less kind of a story, and that has, with irresponsible behavior, that has come to a point where the numbers are the way they are right now. And unfortunately, they don't look like they are going to be abating anytime real soon. So yes, it is a situation. I think that most authorities will agree that the lockdown is not the answer. But if this kind of behavior continues, they may be left with no option but to impose a lockdown. So it's a tricky situation. I think it is important to keep talking to both the community and people and community leaders to emphasize that the lockdown is only going to be harming their own interests. But in the event that these numbers continue in the larger interest of the community, that may be required. So we will know more in the coming few days. Hopefully, better sense will prevail, and we may be able to arrest the numbers the way they are. But like I said a little while ago, we'll probably know only in the next few days, few weeks' time.
Dr. Sunila, if I can come to you here, in your own assessment, do you think that, the administration and the authorities need to do more to impose, the guidelines and the rules better? Because even threats, for example, what Chief Minister Uddhav is saying, that lockdown-like situation will be reimposed if people don't follow rules, none of that seems to be working either.
Thank you so much for having me on the show. And let me tell you that this is indeed a very serious situation. It cannot be taken it so lightly because in India we have got total 62,714 cases. If we look at Maharashtra, we have got positivity rate of 22.78%, which is quite a serious condition. If we look at Chandigarh, 11.85% and all that. So basically, if we say that, the people are fatigued and all that, that is one of the kind of that can be taken into consideration, that okay, but then you see we have to somewhere bring a kind of a situation where people do understand that if they are healthy this year they will be able to celebrate the festival next year. So the holy celebration can be celebrated in many ways, whether it's in the form of virtual form and all that, but if people do not understand and do not follow, then state has to come into picture, where you see we have to be stricter, and we cannot let this having parties we talked of in Midnapur also, and now we are looking at the Mumbai markets also. So that's where we need to be very, very careful. The numbers are going up. People have to understand. From 1st of March in Bangalore, we have seen about 410 children also who are who are lesser than 10 years and who have been positive. So you see, unless we are very strict, we have to be very clear that you see the festivals will come, but there are different ways of making these festivals more enjoyable. You have a virtual this thing, you have virtual, or you prepare sweets at home, you give, greetings, across, because now there is no kind of a distancing. We in this world, digital world, we are still connected with each other. So I feel it is very, very important that you see COVID appropriate behavior, physical distancing, and along with this, I think I would appreciate that festival lies in the fact that if two people today decide that tomorrow I am going forward to get my vaccination, so and from 1st of April in any case we are opening the vaccination for 45 years and above. So this is, we in no condition you see this can be tolerated, whether we talk of Maharashtra, whether we talk of Bangalore, whether we talk of Midnapur and all that. So these states, they're also, Midnapur is also, coming in the poll-bound state. So we have to see that serious actions they need to be taken if people don't comply to the norms. And you see, we are on one hand talking of micro-containment zones and all that, and today 190 micro-containment zones have been added in Delhi as well. So that's where we can see that, how we have to, follow the advisories which have been forgotten. So to reiterate that, after all, human behavior is human behavior. But somewhere we have to understand the festivals will come every year, but we need to, follow precautions. If the time does not permit us, we need not. There are many ways of celebrating the festivals. Thank you so
Right.
much.
Right. Yes, absolutely. Dr. Anoop, coming to you here, we were just showing the visuals that have come in from Bengaluru specifically, and Karnataka obviously is seeing a spike in cases as well, perhaps not as much as some of the other states, but nonetheless, it is a situation. And Karnataka is one state, even last time round when the lockdown was in place, curbs were in place, we saw a lot of violations happening in the state, and that seems to be the case even now. People in complete, brazenly violating the norms.
No, absolutely, I agree. And the visuals which you showed earlier on are ample proof, saying that all these guidelines are not being adhered to. But let's look specifically at the numbers. September 15th last year, we had the peak in the number of cases, 98,000 cases per day. And then, if you see the latest numbers, we're reaching almost about 60,000 per day. So we're not far off from the peak. Number two, if you look at the numbers as well, again, a bulk of it is coming from a couple of states, Maharashtra and Kerala. But then if you look at specifically Karnataka's numbers, what was around 300, 400 per day, not too far off in the past, in about 3-4 weeks. Now we are reaching almost, last 2-3 days it was 2,000, and today we are reporting about 3,000 cases a day. So the numbers speak for themselves. The numbers are going up. And on the ground, what we are seeing are two specific things. The first one is what I call it as a vaccine swag. Just because a vaccine is there, that doesn't mean that we can, let go of the other norms. And the cases that we're seeing in hospital are those ones who have had the first shot of vaccine in the first week of March. And these are the people who feel that the first shot is done and I'm immune to COVID. And that's the kind of people that we're seeing at the hospital. The second set that we're seeing in the hospital are entire households, coming into hospital. So one person is infected and the entire household coming into hospital. So this is what I call as vaccine swag. Just because it's there doesn't mean that we can neglect the other norms. Of course, the government is doing its stuff. Guidelines have come in Karnataka in terms of how many people can assemble, 50, 100 in specific conditions. Marshals are being put in place. But I think somewhere down the line, as population, as people amongst the population, we need to introspect and say, look, what is my contribution towards this? So I think it's very important for us to re-emphasize the fact that social distancing, masking, hand sanitization will remain irrespective of the vaccine. And this is something which has to be emphasized in no uncertain terms.
Yes, absolutely. Dr. Shrivastav, I want to come to you here and, just get an opinion from you on what do you think seems to be going wrong as far as Maharashtra specifically is concerned? Because if we look at the entire country as a whole, everywhere we are seeing violations, everywhere we are seeing, things completely, largely opened up with the exception, of course, of now that the curbs are coming back. But the kind of spike that Maharashtra has seen, what would you really attribute it to? Because so far, all the reasons that have been given hold true for everywhere else in the country as well.
That's quite right, actually. There are multiple reasons as to why this might be happening. We are almost certainly dealing with a dual strain, a variant of the original strain, and maybe more than a dual strain. It's a little, all of these things require scientific scrutiny. They require to be established on genomic testing. But almost certainly on clinical judgments, this is probably what is happening. Maharashtra has been having the biggest numbers even the last time around when the wave started in this way, and that it is the nature of the virus to be affecting various parts of the country variably. Not all the states are going to be affected at the same time. So there is something which is called the dual strain that we are now in a much better position now because there are samples being collected, sent to Center for Genomic Studies, and we will know much more maybe in the next about 3 or 4 weeks time, 6 weeks time, about what kind of strains we are dealing with, because that is where the core of the science lies. That is the one part that we must be looking at. There is secondly a phenomenon called the immune escape, where the virus knows in its own natural history a way to beat the immune system of the patient. Now, that happens because of a number of reasons, multiple reasons. This is not probably the best platform to speak about that. But the immune escape mechanism is also coming into play. And so this is actually the trickiest part. The immune escape and the dual strains that we are dealing with is probably what is affecting Maharashtra. Of course, we will know much more in a few weeks to come, in a few months to come. But like I said, that requires scientific scrutiny. Once we have that information, that's probably when we are going to be able to say for sure as to why Maharashtra might be more affected than other states. But if you simply have a look at the pattern of what happened the last year around, it is not every state is going to be affected equally all the time. There are going to be patterns where some states will be affected more and less than others.
Yes, absolutely. Dr. Sunila, just taking that point forward, we did see even in the past, last year that is, we saw Delhi go through a couple of waves on its own with seeing a huge spike at one point of time. Kerala, of course, the state which handled the situation the best right in the beginning, massive spike. Now, of course, things have settled down. So different states seem to be going through these cycles at different times. What is your own assessment? And now, especially with these mutations, which of course is very inherent to the virus itself, but with these kind of mutations that have been discovered in Maharashtra as well, how much do you think that also could perhaps be, of course, more studies need to be done, but could be contributing?
Yeah, thank you so much. And I'll say that number one is that why states are facing different kinds of surges at different points of time, and now Maharashtra particularly, we had first of all large chunk of population which did not get infected. The same was true for Delhi also. Then ultimately the Sero survey showed the prevalence of 56% were having antibodies and all that. But then that is one point of time. The second point of time is that that we do have, you see, still appropriate behavior which is not in place, which is we need to put that in place in terms of COVID appropriate behavior. Physical distancing is not there. Number third is that mutant stains are there, and we've already found out, all the stains, whether we talk of, UK stain, African stain, or Brazilian stain, or double mutant stain, they're all there. But to put it in simple words for public, right now, while I'm talking about the vaccine, as of now, you see, we have to follow COVID appropriate behavior, as was mentioned by Dr. Anoop, and also you see by Dr. Om as well, that you see, primarily we need to follow this. But then, even after the vaccination, also we need to follow this for quite some time, because the disease is not out. And we need to, and particularly, you see, when during the festival time, the COVID appropriate behavior has gone even for a toss. I'll say that, otherwise also when your visuals were showing different markets also. So you see, we cannot see, any kind of distancing and all that. People are still in the same form. Today in Delhi, I was seeing that some kind of, imposition has been done very strongly in different markets of Delhi. So like this, the both the government and people can together make a difference, and we have to follow, you see, COVID appropriate behavior at all costs, along with physical distancing, along with, you see, testing, treatment, and containment, which the government is doing. But people have got to comply with these norms, and please come forward for the vaccination. That is important. And I will say that herd immunity is going to come with the vaccination. It is not going to come otherwise. So that is one thing which is very, very important. We need to understand. But after taking the vaccine also, people should not be going into the false sense of security that today I've got the vaccine, I'm immune. The vaccine, the immunity takes some time to develop, and still for quite some time we will have to follow COVID appropriate behavior. That means masking, distancing, and sanitization. So these are important things.
Yes, yes, absolutely, Dr. Sunila. Those are extremely important points for people to keep in mind, knowing that, taking the vaccine doesn't automatically completely make you immune from getting the disease itself, especially in the first few weeks after you've taken the vaccine. That immunity slowly develops, and even then it's not 100% effective as well. But Dr. Anoop, if I can come to you here, with respect to, the kind of curbs that are coming into place, we're seeing many states announce things like one-day lockdowns or weekend lockdowns or night curfews, as has just been announced in Maharashtra as well, and many other areas. The centre has very clearly said that these are not very effective. What is your own sense? I mean, going back into these kind of restrictionary modes, is that the solution?
No, definitely not. And if you look at the reasons why the preliminary lockdowns were effective, it was primarily to ensure that the infrastructure was prepared, the scaling up of the infrastructure, the testing mechanisms, the COVID care centers. These were all set up. So that was the primary reason why initially these lockdowns were put in place. But now that we have these, and to a large extent, one of the reasons why we are seeing so much, a huge surge in numbers could also be due to the fact that our testing infrastructure is very well in place, and we can test multiple number of people, and then that's probably one of the reasons why it's going up. But to answer your question, lockdowns as in the second wave, I don't think that is something which is going to give us the benefit that we need to. That we would have gotten. So it was primarily to look into building up the infrastructure, more about preparedness, infrastructure preparedness, and manpower preparedness. But now that that is there to a large extent, I don't think, if you look at the risk benefit ratio in terms of, we discussed this earlier on at the central level, livelihoods versus lives. And yes, at that point of time, it was lives versus livelihoods. But then now, I think we have had that balance put in place. Infrastructure is in place. Manpower is in place. Lockdowns, I don't think they would give us the benefit that it gave us in the first wave. So clinically speaking and epidemiologically speaking, I don't think lockdown are the answers at all.
Right, absolutely. Dr. Shrivastav, your view on that same question in terms of, what perhaps needs to be done, because obviously these kind of limited lockdowns or curfews where only a part of the day or night is being locked down, or it's just for the weekend or one day, really doesn't have that much of an impact in trying to curb the cases, really. So what is it that needs to be done right now?
You see, there is a term that I kind of use quite regularly. It is called a benevolent dictatorship. It's something that is, you need to be able to enforce the law with a hand that is firm, but still has a gentleness so that you don't become a dictator. So I don't know if that is possible, but I think that would be the approach, where you will need to keep talking to the community. You'll need to get community leaders. You'll need to get people within the community, whether they are the local police or they are the paramilitary staff, or I'm sorry, not paramilitary, I'll take that back, but police or staff that can help such people to be able to talk to the people who are out and not following norms, to be able to understand that they are harming themselves. Other than that, look, I don't think that we can enforce law in such a way where everybody will need to be staying indoors. I genuinely feel that there is a state where people are coming to a point where they couldn't be bothered. I don't think we need to be going in that direction. People will need to be spoken to. That's the only way out. I don't think that there is a second option here. Unless we do that, unless we are able to talk to people and get them to see that there is a larger picture, there is a community good, and that an individual cannot be holding an entire community to ransom. That is the thing that I think will need to be done repeatedly, as gently as possible. But then if it is required, then you have to do it, because how many days are you going to lock down, and for how many people can you put the entire state into a lockdown?
Yes.
So it's a tricky situation. Look, I don't know if there's any easy answer to this, but it will need to be pursued. I don't know if there's any other option.
Yes, absolutely, Dr. Shrivastav. Extremely important points that you've raised there. I'm afraid we're completely out of time. I'd like to thank all of you for joining us on this discussion. And perhaps it's a discussion that we need to keep having, because let's not forget, we are in the midst of a second wave now. There is no two ways about that, and we do need to ensure, it cannot be reiterated enough, that people need to maintain their guards. Keep your guards up, keep wearing your masks if you're stepping out, and also ensure that you're maintaining social distancing, because if this spirals out of control, we might have to go back into a lockdown-like phase, and obviously that is going to be extremely detrimental on so many fronts. So we have to do everything, each one of us, from our perspective, to ensure that the numbers stay down. Thank you so much for watching.